Dr. Molly Brinkman. I'm a veterinarian near Nashville, Tennessee, and this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. Welcome to the Dr. Molly Says podcast. We are doing the Dr. Molly Says pod at the lake today, guys and girls. We are in beautiful West Tennessee, and I am looking at Kentucky Lake. You can't see it because the light would be behind me, but it's a great place to be recording a podcast. So today our episode is in honor of a special pet. I don't even know if I'm going to tell her this yet because she probably doesn't want to listen to this yet. But this episode is in honor of Murphy. Murphy is a dog who died this last week. He belonged to a friend of mine, Lindsay. If you don't follow Lindsay, she's a human nurse. Scrub Hacks is her username handle. And she's a wonderful human being. And she has had two big scruffs, Murphy and Schmidt. And Murphy was one of them. And he was a 10-year-old mixed breed dog who died very unexpectedly in the last few days. And he died from hemangiosarcoma, most likely, which is one of the most common cancers we diagnose in veterinary medicine. It's a very devastating cancer. And if you are a person who has dogs, like dogs, you've either had a dog that had hemangiosarcoma or you know someone who has. So I've had lots of people ask me to do an episode on this, and I've been planning on it, but in honor of Murphy, I wanted to go ahead and do that today and just spread more information about this horrible cancer. So that is what we're talking about today. But I do have a hot take for y'all first. I hope everybody's doing good. My hot take is that if something were super helpful, at least a large portion of the veterinary community would be recommending it. Okay? What I mean by this is just today, I just happened to see a post in this like mom group on Facebook where I live. And this woman who actually turns out is a human physician posted asking about anesthesia-free dentals for her dog. She's like, does anybody know much about this? Have you used anyone in town for this? And I commented just letting her know like, hey, FYI, the reason vets don't perform those is because they're overall not helpful, not safe, stressful, painful for your dog, et cetera, et cetera. If you're listening to this or watching this and you've never heard a vet talk about this, please do not put your pet through an anesthesia-free dental cleaning. It's not going to help them. It's only going to hurt them. So I tried to explain this to her, and she got very combative with me and very offended and thought I was insinuating that she was a bad pet owner. And then turns out she's a human physician. And so it just reminded me, I was thinking about this, like there's a reason her vet doesn't offer that because her vet doesn't recommend it. And there's a reason the people that are recommending anesthesia-free dentals do not have any training in veterinary dentistry for the most part. So anyway, that is just one example of many of if the vet community knew that it was helpful, we would be recommending it and not harmful. We would be recommending it. Okay, that's my hot take. All right, we're going to jump right into it because this is sort of a depressing topic, but it's an important one. So I want to give you lots of information about what is hemangiosarcoma, who does it affect, what does that look like? And then we're going to talk about some screening options, some preventative options for it, and potentially some words of encouragement and hope. So we're going to jump right in. Hemangiosarcoma, if you've never heard of it, this is a type of cancer. It's very common in dogs. Cats can have hemangiosarcoma. This is majorly a dog problem. It's a cancer that arises from blood cells. So actually the endothelial cells, so the lining of blood vessels is where this cancer arises, where something goes wrong with cell structure and DNA, and that's how this cancer starts. And so dogs who develop hemangiosarcoma, once we see them having this cancer, that has been there usually for at least months because it's been brewing on a very tiny level within the blood vessels. So it originates in blood vessels, and then tumors can grow. They weaken the blood vessels, and so you'll have tumor growth, weakened vascular supply, and those can rupture and cause bleeding is what usually happens to let anybody know that there's something wrong. Some people call hemangiosarcoma the silent killer, and that's because in a lot of cases, most of cases, I would say still, these dogs seem totally fine, and then one day they just are suddenly not okay, and it's because they have a tumor somewhere that's bleeding. So there are some dog breeds that are more predisposed to developing hemangiosarcoma. Any dog can have it, but when we as vets think about, a dog with hemangiosarcoma, we think about golden retrievers, German shepherds, labs, boxers are a big one. Typically, we do see this in older dogs. So depending on the breed, old means different ages, but in general, 7, 8 years or older. And like I said, it can affect any breed, any kind of dog. We don't know of any very strong environmental risk factors. So this is more random than anything with some breed predisposition. And typically what happens is, like I said, these tumors, weak vessels develop in one of 3 organs are what we see most commonly. So the spleen, the liver, and the heart are the 3 more deadly places we will see hemangiosarcoma arise and cause problems. If you don't know what the spleen is, it's a less known organ. The spleen lives in the abdomen. In dogs, it's kind of in the middle of their abdomen, and it's sort of this oblong, sort of flat, but pretty big shaped organ. The spleen is responsible for a few different functions. It does hold red blood cells and releases them when that's needed. It has a few other functions, but the spleen is an organ that dogs can live without. And like I said, it is in sort of the middle of the abdomen. It has very large vessels that go into it to supply it and run out of it. It ends up being sort of close to the stomach. And the spleen is a place we see hemangiosarcoma form very often. The liver is another place where we'll see it. If you don't know, the liver is in the more cranial or more forward part of the abdomen, very close to the chest. The liver has different lobes. So there's kind of different sections of the liver. Liver has very large, important blood vessels that run through it and out of it. And hemangiosarcoma can cause these tumors in the liver that can bleed. In the heart, the third big place we see hemangiosarcoma, it often causes tumor growth in a certain area near the heart base is typically what we see, or within an atrium. So one of the smaller chambers of the heart at the top where the vasculature more comes into the heart. So we'll see tumor development of a hemangiosarcoma there. And they can also have development in more than one location since it does arise from blood vessels. It's easily spread. So we do see this sometimes in the spleen and the liver, or the spleen and the heart. And often when we're seeing physical evidence of a tumor in one of those places, it's also possible that there's microscopic evidence of this cancer in another location. Those are 3 common, more primary areas where this cancer will form. We do see metastasis of this cancer in other places. The lungs are one more common area where we'll see metastatic cancer arise. So secondary growths, tumors, nodules we can see in the lungs in patients who have hemangiosarcoma somewhere like spleen or liver. So hemangiosarcoma over time, as it grows, it causes, like I said, blood vessels to weaken. And so these tumors will often bleed. And so when we see a patient with hemangiosarcoma, a lot of the time they have what's called a hemoabdomen. So it means the splenic tumor or the liver tumor that they had has ruptured, or it's leaking blood because of those blood vessels being weak. And so they're actively bleeding into their abdomen. So they're hemorrhaging. And these are often big dogs. They're losing a lot of blood really fast. These tumors can actually rupture. So they can be holding a lot of blood. And then suddenly they rupture, they open up, and it's just pouring blood into their abdomen. So what does that look like? So dogs that have hemangiosarcoma and hemoabdomen as a secondary problem, they'll suddenly just be very off. They can be very lethargic. They can collapse. They're going to look pale. Their gums are going to be pale, and they can have a rapid heart rate. They can have a hard time breathing. Sometimes we actually see their abdomen is distended and they really just don't want to get up. They're just laying there. And then as they lose more blood, they can start to have seizures. They can lose consciousness. And if it isn't addressed very, very quickly, these hemorrhages are often fatal. In some cases, especially when the tumor is in the heart, this can be a little bit more subtle. That was the case with Murphy. They can just, as these tumors in the heart, so if hemangiosarcoma is affecting the heart base, the heart has a sac of tissue around it, called the pericardium. So it's like this thin sac of tissue that holds all the heart muscle together. And it forms like a bag around the heart. And so these tumors are within that sac. And so when they start bleeding, that pericardial sac can start to fill up with that fluid. And that can be a slow bleed. And over time, that puts more and more pressure on the actual muscle of the heart because the blood is contained within this pericardial sac. And dogs with heart-based hemangiosarcoma often eventually go into what's called cardiac tamponade, where the heart can't pump because that muscle is pumping against all of this blood, this fluid, and that causes a lot of problems, and it eventually is fatal if it's, again, not addressed. So in both circumstances, we've got blood in the abdomen or blood around the heart, and that is going to cause, obviously, anemia because we're hemorrhaging. In the case of the heart, it's going to cause often fatal cardiovascular problems. And in the abdomen, that anemia just becomes so severe that dogs will eventually pass away from that. So both of those situations are fatal unless we have some type of medical intervention. So sometimes we do see these patients before they pass away. That often happens because you all are great pet owners. You recognize something's off with your dog. You take them in. We recognize what's going on. And in some circumstances, we can intervene and stop the bleeding. If we're talking about a tumor in the heart and we have what's called pericardial effusion, what I was telling you about, cardiac tamponade, we can put a needle through the outside layer of that pericardial sac and remove some of that fluid. Sometimes that will stop the bleeding temporarily, buy us some time to kind of evaluate where do we go from here. In the case of what we call a hemoabdomen, there's blood filling up in the belly because of those tumors in the liver or the spleen. We can stabilize those patients sometimes if they're not actively hemorrhaging and do surgery. And we go in, and if it is the spleen, we can remove the spleen that has the tumor in it, stop the bleeding, give them a blood transfusion, get them stable, and go from there, like I said. In some cases, that's the situation with a liver tumor. Prognosis as far as doing surgery is better with a splenic tumor because dogs do much better when we remove their spleen in comparison to having to remove any part of their liver. And so those are the three sort of medical presentations of dogs that have end-stage hemangiosarcoma. It's causing bleeding, it's caused this emergency medical event, and that's how we address it. Hemoabdomen, meaning blood filled in the abdomen, can happen for different reasons. Hemangiosarcoma is not the only type of cancer that can be in the spleen and the liver. It's not the only type of cancer that can be in the abdomen. And cancer is not the only reason that a dog could have a hemoabdomen or pericardial effusion and cardiac tamponade for that reason. So today we're going to also talk about hemoabdomen a little bit because it's very relevant while we talk about hemangiosarcoma, but I think it's really important to make sure I tell you it's not the only cause of hemoabdomen. So if you have a dog who has a belly that's full of blood and fluid because of something like this, it can be for other reasons. It isn't absolutely cancer, but hemangiosarcoma is the most likely cause of that. So let's talk about hemoabdomen for a minute. We're going to pivot just a little bit because I don't want to have to go back to this, and then we'll move forward with the talk about hemangiosarcoma as a cancer. So when we in veterinary medicine see a dog who has a hemoabdomen, we start to think about and talk about with our clients, what could this mean? So an abdomen full of blood looks like they have a tumor. usually or often it's in their spleen, we start to talk about what's the likelihood that this is cancer, because pet owners have to make the decision when we have a hemoabdomen, because it's urgent. Okay, are we going to do surgery to try to save my dog's life? Take the spleen out, look at the liver. Are we going to try that? Because often we're talking about thousands of dollars. We're talking about a major surgery. We're talking about recovery. And so these are important clinical questions. So in dogs, here's what studies say. There's a lot of research about this. It is evolving. There's some updated thought, but for an established amount of time, if we have realized that if we see a dog who has an abdomen full of blood and because they have a tumor in their spleen, let's talk about their spleen. We think at least 50% of them are malignant, probably more like 60% of them, maybe even more, are malignant, meaning they are cancerous. Of those that are cancerous, the majority of them are going to be hemangiosarcoma. So I do tell clients this because I explain to them, especially if it's an older dog, 7, 8 older, the odds that this is a cancerous tumor are high, but they're not 100%. And I have done surgery on many dogs who had tumor in their spleen, bleeding into their abdomen, 10 years old. We did surgery. Turns out the tumor was benign and not cancer. So there is at least 30 to 40% chance in a lot of these cases that it isn't a cancerous tumor. But even benign, non-cancerous tumors can cause hemorrhage, major bleeding in the abdomen. And then if we determine that a tumor is cancerous, the majority of those are going to be hemangiosarcoma. I hope that makes sense. This is like literature research. But those are the odds, and those odds are important to consider when we're talking about surgery. The actual surgery to remove a spleen, that's the most common surgery we're going to do with a hemoabdomen. It is a major surgery. We're going to open your dog's entire abdomen. We're going to identify their spleen. We're going to have to ligate several very large, very important vessels. Vessels that, if they're not tied off the right way, if they're accidentally cut, they could cause more fatal hemorrhaging. We're going to have to be the surgeon is very careful and very diligent about taking the spleen in the right way, avoiding other important organs. The pancreas is right there. It's closely sort of related to the stomach. There's a lot of important structures right there. We're working in an abdomen full of blood. So it is a major surgery. It requires skill. It requires a veterinarian. But experienced veterinarians can get in there and get out really fast. Splenectomy is one of my favorite surgeries to do. I can get that done in about 20 minutes. And often that's important, and that we can do it quickly because we want to get in, we want to stop the bleeding as fast as we can. And then these patients are usually not super stable. So we want to keep them under anesthesia for as short a time as possible. They're going to be treated with IV fluid support, often other medications to keep them stable. Sometimes they have poor blood pressure because of everything that's going on, so they may need support for that. There's another thing that happens in dogs with hemoabdomens where we take their spleens out. They can have an arrhythmia just because of everything that's going on. And so some of these dogs have to be treated for that and kept on lidocaine drips. They are often monitored for several hours after surgery. Most of my hemoabdomens, splenectomies, I'm going to send them to an ER, usually send them to veg for the night after surgery so that their heart rhythm can be monitored, so that they can be given IV fluids, be watched very carefully to make sure they're not bleeding. But if those dogs do well in surgery, if they tolerate surgery, they survive surgery, they get through what I usually tell my clients, the first 48 hours, most of them recover pretty well, even if they have hemangiosarcoma or another type of cancer. After that point, the big recovery is just that they have a large abdominal incision that we're healing, and we're helping them get their strength back, and we're waiting for biopsy results. Because if we take a spleen out, we usually are going to send that out. If there's a tumor, find out, is it cancerous? Is it not? Same thing goes if we take part of the liver. And then once we get that hemangiosarcoma diagnosis back, once we've sent out a biopsy, if that's what we get, then we go from there. So once a dog that's diagnosed with hemangiosarcoma goes to oncology, then the oncologist is going to want to probably do some staging, to make sure the cancer isn't in other organs, or if it is, where is it? They're going to check for that thing we talked about before. Metastasis in the lungs is a common spot. And then they're going to talk about ways to palliate these patients. It's important to remember that in veterinary oncology, most of the time, we're not curing cancer. We're keeping cancer at bay to buy time where our patients have good quality of life. And that is the case in these oncology patients with hemangiosarcoma. There are chemo options in addition to surgery that can help prolong the amount of time that those dogs can be happy and here. And so with chemo and surgery to remove the source of the hemangiosarcoma, we can have on average 4 to 6 months with these patients. Some will last longer than that. Not all the dogs read the textbooks. Those are averages, but it can buy us months of time. I will tell you that a lot of my clients who have dogs with hemangiosarcoma that have a splenectomy, for instance, a lot of them choose not to go to oncology. And so they remove the bleeding problem and they take their dogs home and they spend quality time with them until they are sick again. And that's a very reasonable way to go. But I do make sure my clients know they do have an option to go on to oncology, talk about chemo, buy them some more time. And again, chemo in dogs looks very different from chemo in people. We're going to talk about this more on the podcast, but most dogs tolerate chemo quite well. And other than having to go to a vet's office to have that done, it often does not affect their day-to-day life that much. There are some newer therapies that can be tried, and we'll have an oncologist on to talk about this more later, but some immunotherapy options, different things. And obviously research is growing about all of those things. And so I'm hopeful that in the future we'll have better treatment options for these dogs. So removing the tumor in the abdomen if it's in the spleen, occasionally if something's in the liver, is our first step. And then we think about maybe we'll do chemo. Now, when we're talking about tumors in the heart, we really don't have good surgery options for that. And so those patients are more complicated because we don't have a good way to just go in and take that out. But they can, again, respond to chemo. That can be a viable option for some cases. But often when we have hemangiosarcoma that's affecting the heart, these patients, they have pericardial effusion, they go into tamponade. Those are very serious situations. And even if we remove that blood, we get it under control, that can happen again at any time. It's very scary for the people and the dog. And in a lot of those cases, euthanasia is what is chosen. And that's what happened with Murphy. And it's a very reasonable and understandable choice for those dogs because, again, the reason hemangiosarcoma is called the silent killer is because these dogs seem usually totally fine until suddenly they're just not. And when it's in their heart, it's just really life-altering for them. And most of them don't survive even the first incident of cardiac tamponade. So hemangiosarcoma, it's hard for us in veterinary medicine to see these patients because so often we'll, see a dog for their annual appointment and maybe a month or 2 months or 6 months later, they run into our clinic because they've suddenly collapsed and they have an abdomen full of blood and their owners are like, how could this have happened? We were just here, or they seemed fine yesterday. And so I'm just here to tell you that that is very, very common. That's a common conversation that we have to have, that they do seem fine until they're just not fine. And that makes these cases even more devastating and just hard to process for pet owners. So another thing I wanted to talk about in light of discussing hemangiosarcoma is prevention. And I want to preface this conversation by saying we have no definitive perfect tests for this. We are still learning and finding ways to try to pick up on this early on. And so anyone who's listening who has a dog who has died because of hemangiosarcoma, please know that you are a wonderful pet parent and I don't think there's anything that you should feel any guilt or like, oh, I should have done that. These are new things. These are new thoughts. and none of these are perfect. So moving forward, if you're hearing this, these are things that you can do to possibly pick up on signs of hemangiosarcoma in your dog before they do have a hemoabdomen. But again, even these screening things I'm going to tell you about are not going to prevent that cancer from forming. And so by the time we see any evidence of this cancer, it has already taken hold and it's already causing bad things, bad effects. They may just not be evident on the outside yet. So there are some ways that we think we can pick up on the internal changes that are happening in dogs that have hemangiosarcoma and other types of cancer. So the first thing I wanted to talk about is Nu-Q. So there is a blood cancer screening test. We call it a liquid biopsy that has become more and more popular in veterinary medicine. Antech is a lab company that makes this test. So it's called the Nu-Q. There was another one called OncoK9, I think is what it's called. Unfortunately, that company did not make it. So it was on the market for a while. It's no longer on the market. So right now, the Nu-Q blood cancer screening test is the most likely cancer screening that your vet might tell you about. It's readily available to veterinarians. It's a blood sample. And what it does is it picks up on, I believe it's nucleosomes, so fragments of DNA from cancerous cells. It measures those in the bloodstream. And so based on research and studies, this company has said, or this Nu-Q screening test diagnostic determines that different levels of these nucleosomes can indicate a higher risk of a couple types of cancers, if that makes sense. So this is not a definitive test. This test does not say your dog has these cancers or your dog absolutely does not have these cancers. It's a screening test. It's intended to be used in healthy patients as just kind of like something to tip us off if that level is higher. So there's 3 different kind of tiers of risk. There's low, moderate, and high risk. And there's numbers, objective numbers correlated to those. So we do, in the practice where I work, we can run Nu-Q in the clinic. We do offer that for any patients. Our middle age to older dogs, we definitely offer that as just like a screening tool, like when we do wellness blood work. It can be very helpful if we're monitoring that every year or every 6 months. That level is low, and then suddenly we get a moderate or a high reading that can tip us off that there may be some cellular changes going on somewhere in the body. We may want to be on the lookout for signs of a cancer somewhere. The 3 cancers that the Nu-Q test have been studied to pick up on. So basically they compared patients with or without these cancers, and their numbers are hemangiosarcoma, lymphoma, and I believe the third one is histiocytic sarcoma. It's not a common cancer that we see. So the 2 big ones are hemangiosarcoma and lymphoma that we're trying to pick up on with that test. So liquid biopsy, Nu-Q is not the only one. There's another lab that does some blood cancer screening. I can't think of the name of it right now. It's a little bit less well known. And then there is another cancer screening test. I want to give a shout out to this company because I know them to a certain degree. They're great people. Oncotech is the name of this company, and they have a urine cancer screening test. And it's actually very cool what the studies, the research behind this test. So the Oncotech screening test, you send a urine sample in from your dog. They kind of extrapolated some of this research from human research, but basically they put the urine with this organism that is known to react to VOCs, volatile organic compounds associated with certain cancers. And these little organisms, they're nematodes, they move a certain way or amount in response to VOCs, volatile organic compounds, smell basically of cancer cells in the urine. Crazy, right? So there are a few different types of cancer that this has been shown to pick up on. And so you can send this cancer screening, urine screening to this company. They do that testing and then they report a similar result, like low, moderate, or high risk to your veterinarian as well. And then you do what you wish with that information. So what do we do with that information? With cancer screening tests, again, for me, I view this as a tip-off. We take it with a grain of salt, right? We don't panic about it. We make sure we did the test right. And then we start talking about, okay, what's another layer of evaluation or screening can we do to determine the likelihood that there is actually something going on? So, in addition to that Nu-Q or Oncotect cancer screening, if we get a moderate or a high result, then we're either going to just recheck that liquid biopsy test in a certain amount of time, or we start to do some imaging. So x-rays of the abdomen, x-rays of the chest to see, does the spleen look enlarged or abnormal? Does the liver look enlarged or abnormal? Obviously, we're going to want to make sure regular blood work is normal. Our chemistry, our CBCs. Does the heart look different, enlarged, anything abnormal in the chest? And then the next step would be ultrasound. So abdominal ultrasound is really the most accessible way to really see what's happening in the abdomen, right? With an ultrasound probe, we can find, or a radiologist, someone who's trained to do this, or a VTS in radiology, a veterinary technician who's trained to do this, they can find all of the organs in the abdomen. They can see what that organ looks like. They can see if there's bleeding around it. They can see if things are enlarged or dilated. They can see the texture of the tissue in that organ. So abdominal ultrasound gives us a lot of information. And my friend, Dr. Mike Walker, just posted about this, but I agree with him. I think talking about abdominal ultrasounds as a screening tool, something we should be doing more, something we should be considering more, because if there's a tumor growing in the spleen, your Nu-Q test, if it's a hemangiosarcoma, it might be elevated, but even if it's a benign tumor that's growing in the spleen, it could rupture and cause a fatal hemoabdomen. And so I think abdominal ultrasound is something we should be considering talking with owners about, especially if they have a large breed dog who's over 6 years old, like a golden retriever or a boxer or a lab. One of these dogs who's more prone to this cancer or these issues. Maybe we do an abdominal ultrasound once every year and make sure everything looks okay. For clients who can afford that cost, I think it's a good use of money. And I think if we were doing that more often, it would absolutely cut down on the number of dogs we see with a hemoabdomen, a belly full of blood, a tumor, who seemed perfectly fine yesterday. We don't want to over recommend diagnostics, right? In vet med, we get a little afraid of that. And we get accused of recommending unnecessary tests. But I would say that hemangiosarcoma is one of the more devastating things that we see. It's one of those things where it's just like, you just want to go, like I could have seen this if I had ultrasounded this dog, a month ago. So it's definitely something that I think we should and could all consider. And I would love for ultrasound to become even more accessible to pet owners. So I think all the GP veterinarians that can get trained to do a good, thorough abdominal ultrasound, at least for screening purposes like this, the better. We can detect tumors in the spleen or the liver. We can detect abnormal patterns. We can see bleeding. And I think that can make it more affordable if more GP vets are doing it. And I think we can catch some of these tumors early on. So that is really, a lot of what I think is important for you to know about hemangiosarcoma. It's a nasty cancer. It's a terrible cancer. It happens often. It's a frequent problem. And these patients, like I said, often are totally fine until they're not. So if you have a large breed dog who's over the age of 6, 7, I think it's a great idea to chat with your vet about what can I be doing to screen for these things? How can I be diligent? Absolutely annual blood work, and then maybe adding on these screening tests. So I would love to know what questions you have about hemangiosarcoma. I'd love to hear about your experiences with it. If you've ever lost a dog to this terrible disease, I'm so very sorry. And I know how hard that is. We will be talking more about cancers in general in dogs. We'll talk about more specific cancers. Definitely going to have an oncologist on to chat with us. But just want to get started with this one because it is a big and common one. It affects so many of you. And again, this is in memory and honor of Murphy and my friend Lindsay. And I hope that this episode can help maybe just one patient, maybe help them have this caught earlier, and maybe some prevention, some good can come from it. So I hope this is helpful. This has been another episode of the Dr. Molly Says podcast. You can find us on Instagram or TikTok as Dr. Molly Says Pod. Our episodes are on YouTube every week, so you can watch this as well. Be sure to follow, subscribe, download, and you can also follow me, Dr. Molly Brinkman, at Dr. Molly Says on all the platforms. So Instagram, TikTok, Facebook. And we will see you next week for another episode of the Dr. Molly Says podcast.